Hi everyone, welcome to our second lecture in forensic pathology. And in this lecture, we are going to discuss the medical legal cases. We already discussed the introduction to forensic pathology, and we really defined some keywords that you need to know in forensic pathology that will help us understand the language of forensic pathology. And we also discussed the medical legal investigative system that is used in other countries, such as the Scandinavian countries, and also the medical legal system that we use in Zambia. Okay, so it is imperative that in this lecture we talk about the introduction to medical legal casework, starting with medical legal cases. Of course, we'll be repeating some of the things. You find out that some of the things that we are discussing are, maybe we did discuss them a little bit in other lectures, but that is for the purpose of the enhancing the knowledge of forensic pathology as a whole. So in this lecture, we are just introducing the medical legal cases. So my name is Clement Chilambe from Clement Chilambe Tutorials, and let's get into it. Okay, so we are going to start with categorizing the medical legal cases. So there are 5 categories of medical legal cases. Among them includes, of course, we really discussed this in our first lecture, violent deaths. Okay, that's one. That is, violent deaths are these non-natural deaths such as accidents and suicides and also homicides. And then we have suspicious deaths, that is those that may be due to violence. Okay, and then sudden and unexpected deaths. Okay, these are sudden and unexpected. It is very easy to understand the way they just indicated here. And then we have unattended deaths, that is those in which a physician is not really in attendance, and deaths in custody. I think we really did discuss in details, and also we defined these categories in our first lecture. And if you are finding difficult to understand again, you can go back to the previous lecture that we discussed, which is lecture 1, to ensure that you understand as we go. Okay, you also need to know that the individual jurisdictions may modify these categories, either expanding or contracting them. Okay, so it depends on the individual jurisdictions. Okay, so when you look at the prevalence of medical legal cases, okay, so considering the prevalence of medical legal cases, we find out that in most communities, approximately half of all deaths are reportable to a medical legal office. Okay, half of all deaths in most communities. Now, of these, half, which is approximately 25% of all deaths, meaning we say that in most communities, half of all deaths, which is 50%, right? Now, of the 50%, 25% of all deaths will be accepted as medical legal cases, but 25% might not really be accepted as medical legal cases. So what happens to the rest? So the rest are generally unattended deaths of individuals under the care of a physician. And that physician that we are referring to is one who is willing to sign a death certificate. Okay, this happens, we've given an example here of death in hospice or at home. Okay, so even if a case is not accepted, a written record of the report containing details of the death should be made and also retained. Okay, this is how it is, and this is how it should be. So this is the prevalence of medical legal cases. Then the objectives of a medical legal examination of a body. Okay, why does the body need to be examined? So these are the objectives of a medical legal examination of a body. We did discuss this in our first lecture. One, to determine the cause of the death, yes. Then secondly, to determine the manner of death. This is a topic on its own. We'll really have to make a lecture, or a separate lecture, cause, manner, and mechanism of death. And then the third reason is to document all findings. We'll talk about the autopsy report and everything that is involved. Then the fourth reason among the objectives of a medical legal examination of the body is to determine or to exclude other factors that may have contributed to the death, or how the manner of death should be classified. Then, fifth, to collect trace evidence from the bodies in criminally related cases. That's why that would be one of the objectives of a medical legal examination of a body. Then, to positively identify a body. So when you look at all these objectives, it clearly shows that why would a medical legal investigative system come in to investigate the dead body, okay, if none of these reasons or none of these objects are to be achieved, okay? So the pathologist may subsequently be called upon, okay? I think we also did this part. The pathologist may subsequently be called upon to do what? To testify in court to the findings. Yes, they do. And one thing that you have to note, and that we did not mention in our first lecture, is that the physician is not allowed in some way, for the lack of a better term. So the physician does not have the final findings, right? Forensic pathologists. What I mean is a physician is not eligible to say this is murder, okay? Only the court of law or the courts of law are the ones that are eligible to say this is murder, and they will know how to classify it. A forensic pathologist's job is to ensure that every finding on that particular body is reported and also is recorded. Okay, that is the manner of death, the cause of death. Then when they are called to testify in court to the findings, that's when the court now, due to or depending on what the physician has reported, they'll be able to say, oh, this is murder or any other, this is homicide, this is suicide, or all those things. That is in the cases of a medical legal system. Remember, this is not just mere death, but it is death that needs to be investigated. It's forensics. Okay, so the pathologist also may be called upon to interpret their significance, how they occurred, and the nature of the weapon that is used, if any. Okay, if there is any weapon that is used, they are called upon to interpret. Then, thirdly, we have to determine the time of death. When did this person die? This is also a topic on its own, and we'll really be happy to discuss the time of death. How is the time of death recognized and also finalized, and how is the time of death reported? Okay, so now the last part of this lecture, I would love to just discuss the differences between hospital and medical legal autopsy. There's hospital autopsy and medical legal autopsy, because as we are discussing this lecture, we might find out that we are confusing the two. There are two things, the hospital autopsy and medical legal autopsy. What are the differences? We are going to therefore comprehensively discuss the differences between the hospital and also medical legal autopsy. So the first difference that I would love us to talk about is this one here. So the hospital autopsy requires consent of next of kin. Okay, but in medical legal autopsy, we've given an example of the United States jurisdiction. You find that this one does not require consent of next of kin, and this is how it is in most of the countries. And then, second difference, the purpose. Okay, what's the purpose of the hospital autopsy? The purpose of the hospital autopsy is to confirm suspected cause of death as teaching tool, number two, and also to assess effectiveness of treatment. Yes, medical students might testify this when they are doing their forensic pathology, that hospital autopsies are actually used as a teaching tool because they are called upon to learn about so many things. Yes, to learn about so many things by their forensic pathologists, and also as the forensic pathologist is doing their work, they strive to explain the findings, asking students questions on what would really be the cause of death, to see if they are getting any science or they are understanding the forensics that these forensic pathologists are delivering to students. And then, of course, one other reason that I've not talked about is to confirm suspected cause of death. Okay, so they confirm there, and then assess effectiveness of treatment. This is also in trials and also research purposes. They do this. Then for medical legal autopsy, the purpose is to determine or document the cause of death, or to rule out unsuspected cause of death in criminal cases. This is very straightforward, and you can, I guess you are able to see the difference between hospital autopsy and medical legal autopsy in this manner. Okay. Third, identify our identity of deceased usually is known in hospital autopsy. The identity is known. Many of the times you find out that even a relative will be there to see how the autopsy is being carried out. Okay. And then for medical legal autopsy, identity may not be known, and information obtained at autopsy may be used to arrive at positive identification. So you've seen the difference now between the hospital autopsy and medical autopsy in areas of the unknown and also the known, or in other words, the identity. Okay. Fourth difference, evidence is usually not collected in hospital autopsy, but in medical legal autopsy, evidence is collected and preserved for possible use in court proceedings. You don't throw away evidence in medical legal autopsy. Then, time of death is usually known for hospital autopsy, but for medical legal autopsy, time of death may not be known, and autopsy findings may be helpful in estimating the time of death. Okay. Then another difference, medical records are usually available prior to autopsy in hospital autopsy, but in medical legal autopsy, the medical records may not be available prior to autopsy. Then extent of autopsy may be limited at next of kin request. Yes, this one is very, very connected to the first difference that we talked about. And then for medical legal autopsy, there is complete autopsy is the rule instead of exception. Okay. Do complete autopsy, and it includes the head and the neck exam always. That's medical legal autopsy. Continuing with the differences, under hospital autopsy, the external exam is less critical than the internal exam, because I will discuss this external examination, and there's also what is known as the internal examination. We did provide the definitions in our first lecture. External examination, we talk about everything, the clothes, how the person was found, all those things, everything on the externally. Okay, and then internal, we talk about the internal organs and that. And then under medical autopsy, external exam is more important than internal exam as a rule. Okay, so external exam is more important for medical legal autopsy, but for hospital autopsy, we really care more about the internal exam. External exam is less critical. Then hospital autopsy, photos during exam are optional. You can choose to capture the photos. Those few medical students who've attended the post-mortem procedures, you've seen that your doctor, a forensic pathologist, the trained forensic pathologist, captures sometimes when they are working on the post-mortem case, and then at some point they might not capture, but in most cases they also capture, but they are optional. Okay, that's what we want to emphasize here. But for medical legal autopsy, photos are required to document wounds and findings. There's no way you can report that there were abrasions, there were lacerations, but the photos are saying otherwise, so that is very important. Then hospital autopsy, the body may be embalmed prior to autopsy. Okay, then for medical legal autopsy, body should never be embalmed prior to exam. Okay, embalming, why should the body not embalmed? Or because that destroys evidence. 1, 2, introducing artifacts, and also it would affect the analysis of the bodily fluids such as urine. We are talking about toxicology here. Okay, then hospital autopsy, toxicology usually is not helpful. Samples are usually not taken. Okay, but yeah, when we say toxicology usually not helpful and samples usually not taken, does not mean that there are no samples that are taken. No, they are, but they are not that helpful when we compare it to medico-legal autopsy, where toxicology is an essential part of an exam, and the results may indicate the cause of death. And then, last but not the least, hospital autopsy, the microscopic sections usually are submitted, are examined. Cellular pathologists or histopathologists, you find out that they, after post-mortem cases, you find out that, or post-mortem session rather, you find out that they collect some tissues, and those tissues are taken to the lab, grossed, and also they undergo the process of histopathology, where they have to undergo tissue processing, embedding, and lastly they are stained and also viewed on the microscope. So they are usually submitted, and after submission, that's when they are actually examined. Then for medico-legal autopsy, microscope sections taken in selected cases only in selected cases, not as a routine part of the exam. So these are the differences between the hospital autopsy and the medico-legal autopsy. Okay, there are so many other differences that we can talk about, but they are all classified under all these differences that we have discussed. This is an important exam question, and you just need to know and differentiate between medico-legal autopsy and hospital autopsy. So this is the end of our lecture for today. Okay, thank you so much for your attention and also for listening. See you in the next lecture.